Hello and welcome to the agenda. I am Ajay Kaul. In this program today we will discuss how the second wave of corona has exposed our inadequate healthcare infrastructure. We are witnessing havoc in the country created by coronavirus. People have been distressingly searching for hospitals, for hospital beds with oxygen. Many patients died even as they were still searching for these minimum requirements of healthcare. Some were lucky to get hospital beds, but then oxygen was not available in many cases. The inadequacy of the healthcare needs highlighted how bad our infrastructure in healthcare is. In the agenda today, we will discuss this immensely important subject to understand why we are faced with such a situation. We have with us Dr. Sunila Garg, who is advisor to the Indian Council of Medical Research or ICMR, Dr. Rahul Bhargav, who is a senior consultant at Fortis Hospital, and Professor Aman Agarwal, an economist. But before we start our conversation, have a look at this small report.
It has been said for long that proper attention is not being paid to healthcare sector in India. There has been a lot of talk on the issue, but the sector remained a low priority for all governments in terms of allocation of funds. Now with the second wave of coronavirus striking, a massive crisis is being witnessed in the health system of the country. COVID patients have been desperately hunting for hospital beds with the availability of oxygen. Such terrible is the situation that people have had to carry their COVID positive near and dear ones in their vehicles to distances of thousands of kilometers. Some of them were still not lucky. Many patients failed to get such life-saving essentials and perished, either at their homes or even in hospitals. Such is the pathetic situation in cities and major towns where there are tens of thousands of hospitals. One really does not know how worse the condition would be in villages. Generally, a village has only one common medical clinic with one or two doctors. Forget about treatment. Thousands and lakhs of people in each village would not possibly be having the facility of COVID testing available. At the same time, the vaccination drive has suffered a huge slowdown due to shortages and perhaps mismanagement in some cases. As media highlighted the deep problems in the medical sector in India exposed by the second wave of coronavirus, there have been commentaries abroad also on the issue. A number of reputed foreign media outlets have highlighted the problem in the Indian healthcare sector, causing a major embarrassment for the country. Bureau Report.
Now let's welcome our guests, Dr. Sunila Garg, Dr. Rahul Bhargav, and Professor Aman Agarwal. Welcome to all of you to the program. So let me first go to Dr. Sunila Garg about the healthcare infrastructure in the country, which has, many people say, it has crumbled. The entire world is now commenting on India's healthcare infrastructure. So as an advisor to the ICMR, can you make some comment on this, make some observation on this, what's happening?
One thing which I would like to say is that any system, basically has its counts, and I will say that directly, number of cases are more, but that doesn't mean that the system has crumbled. That is not there. That's where I would like to say that different states are different stages of pandemic. If you look at northeastern states, got very less number of cases. There are 10 states which have got between above 1 lakh cases, and 7 states which have 50,000 to 1 lakh. So, it depends on the state to state also. But then there is, we have to take into consideration that number of cases are high. And that's why we are also advising people that you must focus also on home-based care. COVID positive does not mean that you will require hospitalization. People who are having oxygen levels of more than 94 and 94 to 91 can be managed considering different things that they can be monitored
Yeah.
at regular intervals in proning position and all that, and they can monitor very simple things like paracetamol, zinc, vitamin C, and all that. But they have to be in contact with the doctor, and some positions like proning and all will definitely help that. So I think these are some of the things because everybody wants to run towards doctor. The moment I will come, I am positive, I will say that okay, let me consult a hospital, let me be admitted. That
Because
is
I may,
not
Dr. Sunila Garg, I may point out because there is immense panic. Whenever anybody gets fever or cough, he starts panicking. And among the patients, such patients, only the privileged people get hospital beds. Even if they have
Ajay
mild symptoms, they can get the hospital bed. But chronic patients don't get it. So there is a discrimination there also.
Yeah, Ajay, that's very, very important question what you raised. That basically, you see, we have to do the hospital audit also.
Yes.
In UP, when they did the hospital audit, found on one day there were 380 patients who did not require hospitalization, but they were there.
Right.
There are people who are covered by insurances or by different systems. They want to, get admitted. And on an average, a person who is got, infection and is only admitted for oxygen can be discharged within 3 days. But we say that it is on an average, it takes 8 to 10 days. So that is also we have to cut down. We have to make provision for everyone. So that is one thing which we have to, pay a lot of attention. Judicial admission, judicial stay, appropriate monitoring also. Because people are scared that see, COVID means death. That is what they have started correlating to. Or COVID means no admission. So we have to bring a very positive note to this whole thing. Mental illnesses are ones which are playing a very, very, kind of a important role, and people are largely, as you rightly pointed out, that they are depressed. They feel that we will not get appropriate care, and they only look at the, examples of it where there's a young death, where there is, the person is not getting oxygen, person is not getting, or they're not getting remdesivir. Because sometimes it's also overprescribed treatment, so we have to be very rationalistic in terms of the treatment.
Right. So I'll go to Dr. Bhargava about when we talk about the healthcare infrastructure. Dr. Sunila Garg differs that it is not crumbled, but I will say that it has got exposed. The inadequacies in the system have got exposed. I'm not talking about today's government because over the decades we have not paid much attention to healthcare or any social sector. In fact, I'll say. But let us talk about healthcare particularly. We don't have proper, adequate government hospitals, and most of it has been private hospitalized. That has been dependency. What do you say on that?
So I would echo the same feeling as Dr. Garg has said. It is not crumbled. We have been overwhelmed. The right word is the overwhelmed. And the scale and the steepness of any pandemic, any country would have shown the same way. We do accept that there has been fallacy. We accept that the number ratios are not, they are skewed towards private sector and towards major cities. But it is overwhelming. In a 1 month, you get a 4 lakh cases, and that just keeps on getting with an average length of, say, 5 to 6 days. How do you cope up? Italy crumbled, New York crumbled, UK crumbled, Brazil crumbled. So the way this tsunami came, this was expected, and then happened. But having said that, we also know that the panic which happened because of the reporting and clear-cut communication being not taken to the masses, it also led to the occupied beds getting occupied by those who didn't need it. So the idea would have been, yes, we need to spend more, but how much more? Can we go up to 16%? We have got a pending list of.
So that is why we have economist here on the panel. So we'll ask him how much more. Yeah, you
the
continue.
more important thing is 1.6% of GDP is being already utilized. So certain times it's just not the money which is spent. In a country like this, we need to have an intelligent sector or called a health economist who guides us where to spend the money from.
Right.
And health economists in this country are very few in number. So the answer to your question is yes, we have been overwhelmed. We have been able to keep up to the pace. We are building our infrastructures, and look at the oxygen situation. I can sit in Gurgaon today. I can say there's no oxygen problem. How capably we got it over within 1 week. So we are going to rise to an occasion. We have already done it. We have already shown the path. We will do it. But yes, the glaring problems of past 75 years cannot be completed overnight. They cannot be fixed overnight. Public healthcare system has to be strengthened. The tertiary care and the quaternary structure has to be graded in its response. And of course, the financial institutions has to have a backing in comparison of what we blindly keep on falling from UK and US.
Right. So, Professor Agarwal, you heard both from the doctor fraternity, medical fraternity. Now, as an economist, spending on medical healthcare has been always low. It's a low priority for any government, not only this government, or any government. It has been low priority. Any social sector has been, rather. So, what do you say on this?
No, I'm in full consensus with what you just said about the low contribution which most governments have made, both to education and healthcare in particular, not only in India but large part of the world as well. But that is one side. You see, we've had COVID come in last year. We've had other problems in the past, but we've had COVID come in. And the government of India and various other governments have had sufficient time to churn up their machinery to go forward. It's not a question of a debate of public sector and private sector. As a matter of fact, they have to go hand in hand, and both of them need to be developed. What we are facing as a problem lately, which is coming up and surfacing in the last couple of weeks, primarily as an outburst of oxygen, laxity and the reduction which is there, is the fact that the healthcare system is not being managed appropriately. It is not that we don't have good doctors. It is not that we do not have good hospitals, but it is the allocation and utilization of resources which is important. I remember when I was studying and working in the World Bank, and before that studying in Columbia as well, almost about 22 years back, I remember seeing their healthcare was also in problem. But then it's a question of allocation of those resources, like 10,000 ventilators lying idle for last 1 year, not being allocated at all in Bihar. Another 10,000 units lying somewhere else. Now, money has already been spent by the center of the state, but why has it not been circulated? So, large number of world around, they've had healthcare systems, people who have been trained to manage healthcare, because in India it was thought to be that doctors are the best fit, so they will be upgraded, and they are. Many of them have actually proved in the past to have been upgraded to a level where they could manage systems efficiently. But, to have more professional systems, have more streamlined systems, when we are talking of situations like COVID or mass structuring, it's important. Ayushman Bharat has been there. But really, where have we integrated the private, the public, the small clinics and the large district centers into that system so that we could have an appropriate disbursement mechanism which could be there? Large hospitals should have already had oxygen production centers or units installed to them. Now, that could never be thought about and never was done in the past. Clearly shows that the allocation of resources, we have the resources, we have the requisite manpower also. But the other part which I've been discussing with education institutions, especially medical colleges, is that the restrictions being posed by IMA, which is actually throttling the education system of medicine, and that's where we are not seeing many doctors come up. So in my opinion, it is actually the problem of, and that's where we are now seeing various prestigious institutions like IITs coming up and saying, we will be ready to help provide the requisite technical inputs in terms of creating this framework. So, because many people are saying,
it comes down to basically professional management.
Oxygen producers are saying that we have sufficient oxygen in the country. The question here is the allocation from one unit, one place to the other is the problem. That's a supply chain management problem, and not the production and distribution of the oxygen as a problem. And that is creating a problem as per se. Apart from this, there are others. So I'll go to you for now.
So I'll go to Dr. Sunila Garg about, as you heard Professor Agarwal talking about the resources being available. But it's about the issue of management and professional management or maybe rational management. So as advisor to IICMR, so what is your view on this? Is the management issue not being handled properly?
See, primarily, if I could get you correctly, you're talking about the management part.
Management of the resources, how to allocate and how to get things done. When you allocate resources or money for that, like oxygen plants or something, but you have to get those done. Who will get it done? Whose
Definitely.
responsibility
See,
is it?
what I would like to say is that supply chain management is an integral part of any hospital care. As has been pointed out by Mr. Agrawal, that because you see these are pandemic times, and you have to realize that one after the other. We have already faced one phase, now in the midst of second. And the whole system, you can imagine that now we are on the at the point when you see we are also our delivery and health manpower is immensely stressed, and we have to take off that consideration. And this is, supply chain management is not something new what we are doing now. Supply chain management in the hospitals, including the critical care, has been done for years. And we are also to global health security, what you realize that. And this pandemic, you see, primarily is also, not only teaching us, but you see, resource allocation is one of the critical parts. You see, nobody realized that the second wave, the virus, what we get is going to be highly infective, and instead of one person.
But ma'am, there were after the curve, started flattening. First wave curve started flattening. There were already warnings that there will be second wave and it is going to be more severe. There were warnings.
There was a warning about the second wave, but nobody pointed out that the virus is going to affect 100% of the individuals in a family. That to realize. Earlier there was only one individual, two individuals. Now it is we are talking of mutant strains. We are talking of 100% individual. And then again, the rate of hospitalization has gone many times. And the kind of expansion or scale up what we have to do, primarily some are, in the regular facilities, some are in the ad hoc facilities. So you see, I see that over a period of time, definitely, there have been issues in supply chain management because you see, the needs have also increased, basically with regard to drugs, whether it's oxygen and all, can be, and gradually I will see the other side. How system has responded also. We have at how much is our recovery rate, how much is our mortality rate. That's much less as compared to all the countries are doing. So that is where we are able to take care of the pandemic. But as far as you rightly pointed out, Ajit, that supply chain management, definitely if you are having a 2,000 bedded hospital,
right,
and you get suddenly so many cases and they are changing every minute, kind of. So we will have to see that the supply chain management for a larger kind of pandemic, it will definitely get under health management information.
Right. So
it gets taken care.
So Dr. Bhargava, you wanted to say something, because I will ask you about, as Professor Agarwal asked, why don't big hospitals at least have their own oxygen manufacturing plants?
At kind of a very knee-jerk reaction, okay? Tomorrow there is a pandemic on stroke. Will you say that please start manufacturing your own antibiotics? Would you start saying please start manufacturing your own thrombolytic agents? Where will this end? The whole idea is, as a society, as a need, we need to understand, we need to have a plan, which is like a mitigation plan, or what is called based on artificial intelligence. You can decide where you want. I can ask you the same question. Why didn't the AIMS have their own oxygen plant? Why does the LNJP didn't have their oxygen plant?
Yeah, we are talking.
The whole idea is,
we are talking about all big hospitals, including public sector hospitals, not only
that's
private.
what I'm coming to.
Yeah.
So the thing is, the more the capital intensive you become, the last mile gets affected. If I have to put a plant in process today, whether it be 1 CR or 25 CR, ultimately the money, the cost will be passed on to the patient. So the idea is, in a city like Gurgaon, the hospitals, either they contribute or the government helps to set up a plant because there are big hospitals nearby. This was never planned. This was never thought because
Right.
we never faced any pandemic like this for the past 25 years. So you had first tsunami. You never anticipated in Tamil Nadu that these are the mortalities which are going to happen. And after that, you became better,
Right.
you became better and better.
Right.
But having a knee-jerk reaction, becoming an Atmanirbhar, every time talking about an oxygen plant in every house, doesn't solve the problem. You
Right.
have to have an umbrella view. You need to allocate your resources where it is needed the most. So my answer to that the short question, long question in short, is that we need to have a better planning.
Yes.
In a country where 1.6% is being spent on budget, you need a smart planner. You need a smart organizers, smart implementers who can prevent any single money which has been utilized should not get wasted.
Right.
There are umpteen number of cases where the amount of money has been spent either through PM care or by the taxpayer money gets wasted. If there's an audit on the bigger hospitals where the taxpayer money is going, I'm very sure that 60% money can be saved from there. But where's the audit? Where's the health audit?
Right.
Where's the health economist?
Right.
The whole system. The planning
You have raised very valid point.
Healthcare does not fetches you election votes. That is why it's not a priority.
Yes.
The only thing which fetches you vote is free things, freebies, roti, kapra and makan. Those are the things. The moment you, me, people sitting on this panel ask for help, we'll start getting it.
Now people are realizing that healthcare is also important to get votes. So Professor Agarwal, you heard what Dr. Bhargava raised very valid points about resource allocation and smart spending. What do you say on that as an economist?
Now, you see, it's always hard. The problem is that we live in a world of scarcity, and we have started to enjoy the feature of living in a world of scarcity. In India, the requirement of the healthcare facility framework is to the tune of 6 times of what it is currently prevalent. And it is not something which is a situation today, which has been in the past, both public and private taken together. You know, when this pandemic started way back last year and I started interviewing on January, February, March, even before the lockdown, I requested through various televisions, including your channel, to the public officers that why don't the medical students from second year onwards be called for duty to go and work in these particular scenarios, because at least they know what is to be done. But the call was coming last week only when the Prime Minister said...
Very delayed, yeah. Very delayed.
Why is it after a year and a half? You know, do you think that the oxygen requirement is yet today? I'm afraid to go to a hospital for a basic structure. Dialysis is not taking place. If someone gets a heart attack, we do not know whether we can take him or not. Where to take him? A small ERP package which can actually tell how many beds are there across the whole country in different, at least in a state-wise structure, can be made available. But why is it not being made available is not clear, because all hospitals have a registration structure. All, at least private and large hospitals, have a registration structure which is all automated today. And not today, for almost 20 years. Then why can't we integrate some of these frameworks for a consumer? Because we never thought from a consumer side. A hospital never said it is fine, it is I'm existing, I'm making money, I'm making comfortable living. Why do I need to think ahead 2 levels to go about doing it? Some of the large private sector hospitals have done it in their own framework. And that is why large number of people, even in the lower middle class, have started preferring to go there, pay a higher fee, or even take an insurance policy to go about taking care of those healthcare facilities. It's primarily because of the fact that those have at least tried to imbibe some of them, but they have not even done it more than the requisite requirement which is mandated by the government or regulator which is there. And I think this is where it is a question of that particular, and as I said, 10,000 ventilators lying in a room somewhere. Why? So many oxygen concentrators lying somewhere. Why? I think that needs to be distributed. So much of donation has come in this country.
Professor Agarwal, there are
why the government is not allocating them immediately, and they are now coming out with the report in the last 2-3 days. But within the first, second, third day, they should have started working on a framework where they're knowing that donations are coming, that how do they go about allocating...
Professor Agarwal,
it needs to go through.
You are right. There are
mechanism which is actually nothing else but management of systems.
You are right. There are so many whys and there are so many questions, but I don't know when they will be answered. But the time of this program today is over. We will maybe have another discussion next time on the other issues. Thank you all of you for participating in this debate today. This is all in the agenda today. Thanks for watching. I'll be back with another important topic tomorrow. Till then, goodbye.